Knock knock. Gonna wash my hands. Hello Amanda. How are you? Hi Amanda. My name is Camilo Gilaver. I'm the treating physiotherapy. How are
Yes,
you?
I am okay.
Okay. Do you mind if I have a seat here?
Mm.
Not a problem. Okay, Amanda. As I told you, I'm the physio today. I would like to have a seat closer closer to this side. So yeah, I'm just gonna stay here. Okay?
Mm-hmm.
Okay. Amanda, are you able to look at me here? I'm on your left side here. Good job. So, Amanda, so I can know that I'm with the right patient. Would you mind telling me your full name, date of birth, and age, please?
My name is Amanda Gian.
Mm-hmm.
I'm 65 years of age, so I was
Okay.
born in 12th of June in 19 something.
Thank you. Thanks for sharing that, Amanda. I know you had a stroke yesterday. Is that correct?
Somebody said something to me,
Okay,
yeah.
not a problem. We will go over that. But I just want to make sure, Amanda, I'm here. Don't lose your train of thoughts. I'm
Okay.
here. What I was telling you is that we are going to do a physiotherapy session today, and my session is gonna look like this. The first part is gonna be me asking you questions, then hands-on assessment, and the third part will be doing some exercises. How does it sound to you?
Okay.
Sounds alright?
Yeah.
All right.
Yeah.
Do you know where are you now? Where are we now here?
Clinic?
Yes,
Yeah, in
that's
your
correct.
clinic,
And you
yeah.
know what day of the week is today?
No.
And what age are we are?
What
What
age?
age are or what is
Year?
the date? What is
Uh,
the year?
2024.
Correct. And what month are we in?
October.
And the number of died? But all right. I
Mm,
know that you could be a little bit um, with less orientation, a little bit lost in
yeah.
time, but that's fine. I know that you know that you're Amanda, which is great. We're in a clinic, which is great, and you already acknowledge me, so that's all right. That tells me that you are able to respond by yourself. Okay,
Mm.
that's good. So Amanda, I know here. Okay, as I told you before, this is going to be my physiotherapy session. So before we can go ahead, I would like to know, just to confirm a few things. You have atherosclerosis, is that correct? And you are taking simvastatin for that? Yeah.
Yeah.
And you were taking aspirin as well?
I think yes.
Any
Blood
other
thinner is that?
yeah,
Yeah.
any other medical condition that you are aware of?
No.
No. Do you remember what happened yesterday?
No.
Not
I
at
mean,
all? Mm.
somebody was saying right that I had a stroke and
You know what a
vomited.
stroke is? Did anybody
Uh,
explain you what a stroke is?
no, no.
Okay, so there is a part of the brain that did not receive blood supply. All right, so that part is
Oh.
affected, and that part of the brain, the right part of the brain, controls our left side of our body. That's
Oh.
why your left side is less responsive, and you tend to look always to your right rather to the left.
Mm.
All right,
Yeah.
makes sense.
Yes.
So probably the left side, you're gonna feel like you don't feel much of your left side. You feel it's a bit
Mm.
weak. You feel like you are tending onto the right side. All right. So that's what's going on now. And the good thing is that we are in a rehab setting now, where we can uh, do a proper rehabilitation program for you, so we can get uh, you back as better as we can.
Okay.
You know what I mean?
Yeah.
Okay. If anything, you don't, if you there's anything that you don't understand, please let me know so I can, make things right for you and you can understand me.
Okay.
Do you smoke
No.
and do you drink alcohol?
Slightly, but not often.
No, often. What? How many drinks would you have in a day that you drink?
A beer a week, a pint.
Beautiful. Keep on that track, Amanda. and obviously smoking, keep yourself away of smoking. All right. I got from your notes, Amanda, that you live in a single-story house. There is no steps or ladders to get in and out of your house or to the backyard. And you live with Larry, which is your husband, and he's really supportive. All right. He's also concerned of what are you gonna do when you get discharged home, because he has a sore back, and things could be a little bit hard. So I just want to make sure we have everything set for you when you go back home. So I just want to make sure if you are thinking, or would you consider to refer out to the occupational therapist so they can assess your home and everything is set for you.
Costs.
Well, we are going to find about the costs after the session. I will put you in contact with the nurse, and they will let you know all the involved costs and if there is any fundings on that end.
Okay.
But in terms of referral, I would like to know if you are happy for me to refer you to the occupational therapist, and also the social worker would be a good idea. I highly recommend engage you with the social worker, so we can plan as a team what are we gonna do further.
Okay.
You know what I mean? Cool. So I know you are a teacher, or you were a teacher back in the days. Yeah, and you also like gardening. Is anything else that you want to add on that list of hobbies that you like to do?
Yeah, back on my feet,
Get back on your feet, for
Yeah.
sure.
A bit weak and slow and a bit scared.
A bit scared. Yeah, it must be really scary to feel this. Like the body's not responding how it should be.
And they said that, I won't recover from it.
Alright, but that's what they said. Alright, so let's put things in context. Every patient is different, every person is different, so and every patient and every person has their own journey. What does it mean? It means that usually patients has like an overall of 6 months to improve, and then from 6 months to a year, the improvement is a little bit less, a little bit slower, but still improve a little bit. But after a year, the improvement is less likely. The good things for that.
Do I get this?
This is something that we will come with time. We will find with time. This is our first session. There is a few patients that get rid of that, and other patients still having that when they get discharged. But certainly that's something, Amanda, that's something that we are going to work on. All right? Make sense to you? Okay. So, are you in pain now?
Just a little bit, yeah.
Soreness. Did the occupational therapy came to you to assess you? Okay. Together with this all assessment that I gonna ask him to do, in terms of your home's assessment, I would like to the occupational therapy to do a proper assessment of your upper limb and see if there is anything that we can do on your upper limb in terms of any assistive device or any probably a sling would be a good idea in the first place, just to hold your shoulder so it doesn't produce any further harm.
Okay.
All right. I'm going to explain you after I do my hands-on assessment a little bit better. But yeah, that's some sort of things that I would like you to consider. All right. Yeah. So you don't remember much what happened back in yesterday. What is the first recall that you have?
Vomit. I vomited. All
You
over.
remember coming in the ambulance,
No.
maybe some flashlights, emergency department, then you were transferred here.
No.
All right. What about today when you woke up? Do you remember today morning?
Yeah, and
having
I think
your breakfast?
somebody came and see me. I walked.
All right.
I think, yeah,
Beautiful.
20 meters.
Beautiful. So, Amanda, before this stroke, what things were you able to do? You were fully independent, meaning you were going to the shops, drive. What sort of stuff would you used to do?
Yeah, just shops.
Fully
Normal,
independent.
yeah.
All right, good, Amanda. And probably, yeah, now that you are with this stroke and this inpatient, there is quite a few things that you find yourself not being able to do. Is that correct, Amanda? Yeah, yeah.
Mm.
Is that correct? Okay, great. So, what would be your expectations from just today's session? What do you want to achieve from the physio today?
I
Nothing comes to your mind like something that you want to achieve today, or
make me walk again, see again,
all
feel
right,
again.
all right. So feel again, see again, and the strengthening. It's something that it's going to slowly come back, but probably we can work on your confidence in getting standing or your balance if it's an impairment or yeah. So those sort of stuff. What do you think about it?
Great.
Is anything that you would like to add as your goal for today?
I don't know.
You don't know yet. Well, we can find that later in the session as soon as we keep talking, as far as we keep talking, and we will be, getting there. So before we can go ahead, and because you are in Amanda, because you are in a hospital setting, I would like to rule out a few red flags. Okay. All right. So have you experienced any problems with your swallowing? No?
No.
Choking, not that sort of stuff? You told me that your vision is a little bit impaired. There is one part of the here, Amanda. There is one part of the angle of vision that is not working on you. Probably the left side. Your left side is you're not being able to watch much, to see much on this side. Is that correct? All right. Any hearing impairments that you have noticed? All right. Any problem with your tongue or articulating your words or your speech?
I can't get it out quickly.
All right.
Yeah.
So, in that end, Amanda, did the speech therapist came to you and assess you? All right. This is something that I also highly recommend, because stroke patients, there is a high likelihood of getting, the muscle swallowing don't work very well, so probably it will be a good idea to get speech therapy training. All right?
Okay.
Together with the physio, with the nurse, with the neurologist, speech therapist, and occupational therapist. It will be an amazing job. So we can work all as a team for you.
Okay.
Make sense? Cool. Yeah, any chest problems, chest pain, cough, fever? Here, Amanda, I'm here. Yeah. Any chills or night sweats?
No.
No. Any, apart from this new weakness, in any other weakness that you have noticed during your stay here? Loss of sensation in any part of your body? Your left side, probably.
Yeah.
Any new one?
No.
No. Any problem with your bowel or bladder? No. Any? I already asked you for unremitting pain or headaches. No. Cool. Great. Let's go over the hands-on assessment then, Amanda. Okay. Anything that you want to add of your history that you think it's relevant?
No.
No. All right. So, can you look forward for me, please? I know that you tend to look to the right, so that's why I'm going to start standing myself on your left side, so we can start working on that. All right? So, can you tell me when you see my fingers, please?
I see the right one.
All right, not the left one.
No.
What about here?
Yeah, now I can see.
All right. When you can see my left, my right. This is my right. When can you see, tell me when you can see my right finger.
Now.
Alright, what about now? Can you see it
Uh,
moving?
yeah.
Can you see it moving the left one? Your, on your right?
Yeah.
Yeah, cool. What about up?
Yeah.
Up,
Yeah.
down.
Mm.
Do not look down, just look straight to me. Alright?
Mm-hmm.
Cool. So can you now follow my finger please with your eyes? Alright, beautiful. What about going up? Alright, going down. Beautiful. Now keep your eyes on my finger and turn your head to the right. Turn your head to the right, like, yeah, like so. Let me show you. Yep, and then this side. Alright?
Okay.
Alright, so keep your eyes on my finger and turn your head to the right. Keep your eyes on my finger. Amanda, keep your eyes on my finger and turn your head. Good job. Now to the left. Good job. Great. I didn't find any nystagmus, but I was not expecting that. Can you hear this?
Mm-hmm.
Does it feel the same? Both sides? Cool. Do you feel this?
Mm-hmm.
Does it feel the same here? Probably not. What about here? What about here? Alright, so can you feel this? Not too much. Not too much. Alright. There is any local sign here?
It's sometimes a bit sore.
A bit sore. Do you mind if I have a look? Alright. So yeah, because this side is the weak side, I think it's going to be a good idea for the occupational therapist to come and do a proper assessment, but that's gonna should happen today. All right, Amanda, I'm here. Okay. So what I want, to do is refer you to the occupational therapist so they can assess properly your upper limbs and probably put on you a sling. All right. Now, are you with pain here or is just sore?
Just a bit sore.
All right. No sulcal sign.
What's
Sulcal sign. I'm asking my assessors. No sulcal sign.
No.
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 No signs of dislocation. Okay. So I'm happy with it. The occupational therapist will do further assessment on that. Okay. So we are going to focus now on this session on the lower limbs. Okay, makes sense to you? All right. Do you mind if I put my hands on your thighs? Do you feel this? Do you feel this?
Bit.
All right. So
Different.
you still feel, but it's not the same. All right. What about here? All right. Do you feel this?
No.
This? Yeah. What about here? Do you feel this? Do you feel this? What about here? Not much? All right. Close your eyes, please. And you are gonna let me know if your toe is up or down.
Up. Down. Up.
Great. Same thing with the left. Tell me if it's up or down.
Down. Don't know. I don't know.
Good. Tell me if your knee is straight or bent. All right?
Bend. Straight. Straight. Straight.
Okay. Good job. Good job. Now, open your eyes, please, and raise your knee up towards the ceiling. As far as you can. Good. A good kick for me, please. Good. And wiggle your feet up and down. Good job. Now, same thing. Keep your knee up toward the ceiling and leave it there. Don't let me push it down. Well, good job, Amanda. Kick out for me. Leave it there. Don't let me push you down. All right. Bend your knee. And don't let me pull you. Don't let me pull you. Good job. Feet up, feet up. Leave it there. Good job. Push my hand. Good job. Now up, up, and push my hand. Push my hand. Oh, that's a good job. Good job, Amanda. Now we're going to do the same with this one. All right. So up toward the ceiling. Try to wake this leg. Good job. Kick out for me. Toes up and down. Feet up and down. I'm here, Amanda. Look at your leg. And up and down. Alright, Amanda, look at your leg. Look at your leg. Here. Good job. Now, up and down, up and down. Alright, now, up your knee, up towards the ceiling. Up, up for me, up. Yep, and leave it there. Don't let me push it down. Leave it there, leave it up. Don't let me push it down. Good job. Extend your knee, please. And don't let me push it down. Good job. Now, feet up. Don't let me push it down. And push my hand. Good job. Knee up towards the ceiling. And push my hand. Push my hand. Wow, that's a good job. Beautiful. So, basically, Amanda, what I found here is that here, remember, I know you sometimes lose your vision, but this part of your body is not working pretty well. Same as your left eye is not getting the information. The left part of your vision is not getting the information towards your brain. All right. What we need to do now, because this is the acute part of the rehab, what we need to do now is reteach all your neurons or your connections within your brain to restart taking all those functions. All right. So what does it mean? The more we do, the better and the faster we get.
Okay.
The more we do, the faster we get better.
And how long am I going to stay here?
Here in the rehab setting, it's not up to the physio, probably. It's up to the neurologist and all the team. But it is really soon now. It's just been 2 days. We are looking probably in terms of weeks, a couple of weeks or probably a month. But everything is up. It's going to be up to the medical team, especially the neurologist. And as soon as we find that it is safe for you to go home, yeah, you will be discharged. But now it's really soon, so let's go step by step. What I mean by that is that try to work as much as we can, try to do as much activity as we can, so we can reteach the brain to take all the functions that it lost.
Okay.
Make sense to you? All right. So now I want you to stand up. You are not having problems on that, I think. So stand up for me, please.
You're joking.
No, I'm not joking. I'm not joking. And because this is my first time with you, I would like to put this pelican belt around you. All right? So my assessor, which is my assistant, is going to be on your right side. And because this is your weaker side, I'm going to be standing on your left. So be reassured, you are not going to fall. I'm going to be here the whole time. All right? Okay? All right. 1, 2, 3, up. Up you go. Up you go. Up you go. Good job. Good job. Up you go. Up, 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 up. I know you were able to walk with no assistive device and with the assistance of only one. So probably you will find yourself your balance. Good job. Feels better there? Feels better there? All right. Now try to work on the alignment. Yep, that's what we want. All right. I should probably have a chair close to you. Yep. All right, I'm holding you, so I want you to try to do some marches on the spot. Yep, both of us are holding you. All right, all right, all right. Good
What am I
job.
supposed
Go
to
back,
do?
go back to the chair. Beautiful. All right. So there is a lot of knee buckling. Um, I'm not sure if would be a good idea for you to walk because I'm not sure if you are going to be able to bear weight on that leg. All right. So, but we still can do a lot of work here while we are sitting. All right. So basically, because there's a lot of knee buckling, I will like to start strengthening that leg, that side of your body, and also work on your alignment. All right? Sounds good to you? I'm just gonna get myself a chair. All right?
Yeah.
Can I get a chair from there?
Of course.
Okay. Okay, so we have assessed you, your strength and your sensation and your proprioception. That's not gonna improve much today, but it's gonna come over the days. What it means is the more we do, the more exercise we do, the faster we get better, the sooner we go home.
Okay.
All right, and the better we regain all the functions.
Okay.
Make sense to you? All right. So again, holding the pelican belt, I'm gonna be close to you. I want you to stand up for me. My accessory is gonna be holding, just holding there. All right, and I want you to stand up for me. 1, 2, 3. Good. Go. All right, go back for me. Go back. Sit back. All right. If you see your feet is really behind, so make it a little bit forward. Scoop yourself forward, forward, forward. Good job. And then, basically, what I want you to do is try to look your left and your right side feet or legs and make them at the same level. All right. So rock you back and forth 3 times. 1, 2, 3, and when you say 3, you're gonna stand up. Okay? So 1, 2, 3, stand up. All right. Okay. Good, Amanda. How do you feel there? Feeling business? No?
Okay.
All right. You feeling okay? Cool. So if you can see, if you can have a look to your alignment, you will see that you are always tending to go to that side, holding onto this hip. But we want also put some load on the left side. Alright? So let's see how long can you stay there. I'm gonna take the time, how long can you stay there? Alright, let's say 10 seconds. Alright. Can you now do the same but with your eyes closed, please?
Oh.
If you feel any dizziness, let me know. Alright, fair enough. Okay. Alright, are you feeling okay? Fatigue? A little bit, not too much. Alright, so basically what we are going to do now is working on your balance while you are standing. Okay? Here, Amanda, look at me. Yeah, here I am. Alright, so some marches on the spot. Alright, right knee up, and we are going to right knee up. Good job, right knee up. Hands to the side, hands to the side, beautiful. Again, and again. You see, we are putting some load on this leg, alright? That's what we want. We want to give all the input, all the information to this side to start working on, alright? Put your hand here for me. That's all right.
But you put it there? Okay.
That's all right. Beautiful. 10 times. Now, you're gonna do the same with the left.
Mm.
Up, up you go. Up you go. 1, 2, 3. Up you go. 5, 6. Up, 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 up.
Hard.
It is hard
Very hard.
because we need to reteach the brain.
Mm.
You know what I mean? And because this side is a little bit asleep, we need to wake him up. You feel exhausted, or are you okay if we keep doing? Are you okay?
It's hard.
I know it's hard. This is what I want. All right. Same again. Try to keep your knee straight. There you are. There you are.
Okay.
Keep this position there. All right. Cool. That's right. I'm calling you. You're not gonna go anywhere. So, there you are. There you are. Good job. All right. This is not weak. Don't cheat on me.
True, true.
Stop cheating on me. You're doing pretty well there. All right. Let's try to load the left and then the right. The left and then the right. The left and then the right. Right. Keep yourself there. Yep. Keep yourself there. Keep your balance there. Try to hold your balance. Try to hold your balance there. Try to hold it. Try to hold it. Try to hold it. Good job. Good job. The good thing is you're not going anywhere. Alright. Put your right feet close to the left one. Can you make it closer? Yep. Up position, remember? Yeah. Like a chicken. Yeah. Good. Just up. Alright. And keep yourself looking to your left. Yeah. Remember your head has to be there, like so, alright? Alright, I'm going to start working on your balance. Activating a little bit your muscles there. Giving some hints. Good. How are you feeling, Amanda?
Getting tired.
Sure, for sure. But do you
Can
see
I
that
sit down?
you want to sit down? Sit back? For sure. Now, wait a minute. I'm going to teach you how to properly sit. Alright? You are going to go further back. As soon as you feel the chair behind your knees, you're gonna have a seat there.
Okay.
Alright. Oh, how was that? I bet it was really hard.
Hard
Yeah?
work.
Yeah, hard work.
Hard
Well,
work.
this sort of stuff we need to keep doing. These are the exercises that we are going to keep doing during our sessions. Because what I need is that try to make the left side of your body wakes up. You know, we need to make him awake again. He's a little bit sleepy now. He's a little bit drowsy, a little bit lazy, but we need to wake him up. And we are going to wake him up by doing exercises, by moving, by touching, by giving all this sort of information. Are you alright?
Okay.
Make sense to you?
Okay.
Any questions?
Okay. Will I be able to walk again?
This is something, as I told you, this is just my first session with you. But if the first day after stroke you are being able to stand by yourself and weight some and bear some weight on your left side, probably it's gonna come with the time, with time.
Okay.
All right? But we need to keep working as hard as we can so we can give all the information. This has to be like a bunch of information to your brain. You
Okay.
know, the more exercise we do, the sooner we get better, the sooner we go home. All right,
Okay.
and the better we are.
Okay.
Make sense to you?
Yeah.
All right, cool. So, I know that you have been walking. How did you walk to the bathroom with this knee buckling?
Very different. Somebody helped me.
All right, so was just one person helping you?
I think one nurse. Yeah.
All right, you did it with the physio as well?
No.
All right, so we're gonna try just for the sake of the session, we're gonna try it because this is something that you already did today morning and I don't want to go back on your rehab. So let's try to do it and we will see how do you do. All right, so because you were feeling a little bit fatigued, I'm gonna do some exercises while you are sitting here.
Okay.
Okay, so first thing that I want you to do is with your left side, go with your knee up towards the ceiling, up, 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 and keep it there.
Hard.
1, 5 seconds, 2, 3, 4, 5, go down and then kick out for me. 1, and when you do this, remember to bring your toes up.
Yeah.
1, 2, 3, 4, 5, go down. Knee up, 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 up. 1, 2, 3, 4, 5, and then extend your knee with your feet up for me. Good job. 5. So this is one exercise that I want you to do while the physio is not here.
Okay.
All right. So what is gonna do here?
5.
Up 5 and then kick out 5.
5. Okay.
All right. This is the main exercise that I want you to do while you are not with the physio or with the nurse.
Okay.
You are sitting somewhere, whether it's the chair or it's the bed. All right. You're gonna do it 10 times. All right. So we already did 3. So go ahead, complete the 10.
Okay.
1, 2, 3, 4, 5, and kick out. 1, 2, 3, 4, 5. One more. 1, 2, 3, 4, 5. Kick out. 2, 3, 4, 5. Again. 1, 2, 3, 4, 5. Kick out.
Physio, I'm getting exhausted.
Yeah, that's what I want, Amanda. I'm sorry, but that's what we need. I'm sorry if you are getting tired, but this, as I told you, the more we do, the better we are.
Okay.
Okay? Kick out for me. Alright, up you go. Down. And the last one, knee up for me. 1, 2, 3, 4, 5. Kick out for me. 1, 2, 3, 4, 5. Good job. Now that you are sitting there, I want you to do ankle pumps. Yeah.
Okay.
Yeah, 10 times. This is the second exercise that I want you to do
Okay.
in between the physio sessions.
Okay.
As much as you can.
Yep.
As much as you want. Do it while you are sitting, do it while you are resting on your bed. If you are on your bed, you can do ankle pumps as well.
Okay.
Alright? This is going to help you to start feeling again your joints, your muscle, your skin, your tissue from the left side, and all that information is going to run to your brain and reteach all the surrounding tissue how to do the job. All right? They're taking over all the job that the neurons used to do.
Okay.
All right? Cool. Now, again, did you have a rest? Are you feeling okay for trying to have a walk?
Yep.
All right. So, up you go.
What about my knee buckling?
All right.
Okay.
All right. So, first thing first, I'm going to hold you, and you are going to give one step with the left. One step with the left, one with the right. One with the left, one with the right. Cool. One with the left, one with the right, one with the left, one with the right. Alright, come back Amanda, don't run away. Alright, beautiful. Right and left. Okay, so we are here in the parallel bars. Okay,
Yep.
here is the parallel
Yep.
bar.
Okay.
This is the rehab setting. So while you are in there, you can hold it onto the parallel bar here, and probably this is not going to work, but your left side is just to give you the information. All right, but the thing that I want you to do, Amanda, put your feet together, all right. We are going to start working on your gait. Okay, so basically what we're going to do is break down all the steps to make a good step.
Okay.
Make sense to you?
Yep.
Alright, so basically what I want you to do is do this movement for me. 1 and 2, 1 and 2, 1 and 2. Alright? 1 and 2. And when you bring your knee up, I want you to bring your toe up as well. Your toes up. Make sense to you? Alright, 10 times. 1, 2, 3, 4,
Ooh, heart.
5.
My right knee hurts.
I know you got osteoarthritis there, and that's something that, yeah, we can expect. The pain is too hard, it's too bad.
Okay.
It's okay. It's bearable. Alright. Because we can have a conversation with the medical team, and they can come with any sort of solution to, like any painkillers if it's too high.
Ooh.
10. Alright, cool. Now that you are sitting there or standing there, it's the opposite. Yeah, that's the way. Alright. Yeah. Try to hold onto this leg. Hold onto this leg. Yeah. Beautiful. Now, same again. We're going to put some load on the left. Yeah. I'm holding you. I'm not gonna go anywhere. Cool. If you wanna grab on the rails, that's gonna be good. Alright. Now, keep your knee up, up, up. Yeah. 1, 2, 3, 4, 5. Down. One more time. 1, 2, 3, 4, 5. Down. One more time. 1, 2, 3, 4, 5. One more time. 1, 2, 3, 4, 5. So last one. 1, 2, 3, 4, 5. Good. How do you feel? Tired. Alright. Same thing. If you are sitting on the chair or if you are laying on the bed, try to rub your thigh, try to rub your calf well,
okay.
right? Because that is also going to give you information to your brain.
Okay.
All sort of information is going to be useful. Okay?
With a brush?
Right.
I've got a brush.
You can do it with your hand as well.
Yeah, okay.
Yep. So, basically, I want you to go back to your chair. I'm going to have you sitting on the chair as well, again. Alright? Remember what we just learned? Knee up for me. Yeah. Up. And turn around, and have a seat. Cool. I would like just to know how do you stand up now that we have been working a few things. I already see how do you walk, so that's good. Now stand up for me, remembering all the things that we have learned today. Put your feet a little bit backwards. Yep. No, let me show you. Like so, same position for both. Rock you up a little bit. scoop forward and rock you 1, 2, 3, and the 3 you go up, 2 and 3. Good. Cool. All right. How do you feel?
Good.
Less scared of moving?
Yes.
Bit more, less scared of standing up?
Good.
No dizziness?
Mm.
All right. Have a seat for me, please. All right. So basically, the previous session, you needed assistance of one person to stand up, and now you're not needing anyone, which is great. You still need one assistance of one person to walk, but I think your gait pattern is getting a little bit slightly better. Keep in mind the gait pattern that we have been working on. Good knee hip flexion, good knee flexion, and then keep your toes always up.
Makes
all
sense.
right?
Yeah.
And the 2 exercises that I gave you, sorry, the 3 exercises,
Which is this
was
one,
this, kick,
this
and then
one.
ankle pumps.
Can you write that down for me?
100%. As soon as we finish here, I'm gonna write them down for you. Remember, rubbing your leg with your right probably is gonna be easier rather than your left. And I'm gonna make the referral for the OT, speech therapist, and the social worker just to make things ready for you to go back home.
Okay.
All right. Any questions for me?
Thank you.
Any questions for me?
No.
All right. So we're gonna see you at least 2 times a day, every day.
Okay.
All right. That's my plan. Are you okay with it?
Yeah, I wanna walk and go home.
All right.
Okay.
Cool.
Thank you.
See you in the evening.